without change.
We break it all down.
A governor serves 4 years, and the next is that he may be re-elected once. And already most governors begin re-election calculations by the second year in office.
On Let's Talk Nigeria, weekdays at 9 a.m.
Power holders or those in the helm of affairs have deliberately ensured that it doesn't work. So the reason is so that it will favor their intentions that are anti-people.
On Golding 97.5 FM, Yanagora.
Yes, good morning, and good morning, Nigeria. Good morning, Bios. And this is Let's Talk Nigeria, your trusted platform for conversations that inform, educate, and inspire positive change in our society. Today, March 12th, around the world, it is observed as World Glaucoma Day, a day dedicated to raising awareness about glaucoma, a serious eye condition that is often called the silent thief of sight. Many people living with glaucoma do not even realize they have it until significant damage in itself has already occurred to their vision. And according to eye health experts, glaucoma is one of the leading causes of irreversible blindness worldwide. The worrying part is that the disease often develops gradually and without noticeable symptoms in its early stages. However, the good news is that with early detection, proper monitoring, and treatment, vision loss from glaucoma can be prevented or significantly slowed. Here in Nigeria and of course across Africa, many people still do not go for regular eye checks because some persons feel like it's only when you have money you go for medical checkup or anything at all, which makes awareness campaigns like this very, very important. So today on Let's Talk Nigeria, we'll be discussing World Glaucoma Day and the importance of early detection, prevention, and proper eye care. And joining us this morning is we have three important personalities that are present here in the studio. And of course, I have Dr. Akobundu Marachi. Good morning.
Good morning.
It's good to have you here this morning. And I also have Dr. Koroye Egbe Ayakoro. Good morning, ma. I need you to speak. Yeah. Okay. Then I also have with me this morning, I have Dr. Omotayo Abayomi Victor. Doc, good morning to you.
Good morning, sir. Good morning, sir.
Okay. Say again.
Yeah, good morning, sir, and good morning to everyone all over the world watching us.
Okay. So this is a whole lot of things that we're going to be having. We're talking about something important and it's imperative. And when we have this special guests, they're going to be looking at all of these different things. How do we see early detection? How do we prevent it? And many other conversations here. Remember, we are here for you, and this is Let's Talk Nigeria. For starters now, I want to ask Dr. Komodo, because you have been here at many times and you've been our own special guest at different times concerning the eye thingy. To start with, what exactly is glaucoma, and why is it often referred to as the silent thief of the night? Why?
Glaucoma is a group of diseases that damage the part of the eye they call the optic nerve. This damage, occurs when there is high fluid pressure in the eyes. That's part of the eye called the aqueous flow. When there is pressure on that part of the eye, this leads to glaucoma. Okay. Then in a layman's way, if we have to put it, it's just like when you have an electric wire in the house. When the electric wire that connects to the different sockets or bulbs or sockets in the house, when the connections are breached, then there won't be good flow of current. There won't be flow of current, to that part of the house. So glaucoma, when there is a damage to the optic nerve in the eyes is like the wire. Okay, it's a wire through which transmission of impulse, to the brain, where it takes place. When there is damage in that part, and when there is build-up of pressure, in the eyes, it leads to glaucoma.
Wonderful.
Yes.
I would like to ask Dr. Corey, why is World Glaucoma Day important, and what message should Nigerians take from it? Because we're wondering, I know that every day has a theme and everything. What is it about? Why is it important for us?
It's very important because glaucoma is not one of the diseases in the eye that gives symptoms that somebody will know that, okay, something is wrong with my eye, so let me go to the clinic. The World Glaucoma Week is a week to create awareness, to let people know that this disease occurs, but it's not going to give you the symptoms, the regular symptoms that you are expecting, so that people can understand that it is there and it causes damages, it causes eventual blindness if actions are not taken to manage or prevent the increase of the intraocular pressure, as he has said. So creation of awareness is done regularly, but this is a week dedicated for solely glaucoma, to let people know that it is an ongoing disease. It has damaging effect. Let people be aware and then come for free screening anywhere it is holding, and then the need for a regular eye check so that they do not lose their vision, because when it occurs, it is irreversible.
It's irreversible. Dr. Motayo, how common is glaucoma in Nigeria and Africa compared to other parts of the world?
Yeah, due to our genetic predisposition, black people tend to have more occurrence of glaucoma. The incidence among black people is more than the Caucasians. Okay. So as black people, we are predisposed to it genetically. So all we can do is try as much as possible to keep checking up, come to the eye clinic regularly, so that you can know if you have any symptom, any signs of glaucoma in your eyes.
Okay, Dr. Kobundu, because we always had, when you come on air, you talk to us about this eye thingy, and people like, okay. The other time I remember the watchy eyes or no watchy eyes, some person say, oh, that's fine. But Many people also say that glaucoma has no early symptoms. Why do you think it is? Why?
Glaucoma, there are symptoms, for glaucoma.
Okay.
Okay, and some of those symptoms are when you are having pain, regular pain in the eyes, headaches. These are still part of the symptoms of glaucoma. Reason is because this, when the buildup of fluid in the eyes, when there's buildup of fluid in the eyes, it could lead to these severe headaches that come up. Okay, and because you're not actually an individual that is not an eye doctor, does not know the symptoms, you might feel it's just an ordinary headache, So, and when you see your eyes, when you feel headache, you feel pains in your eyes, these are symptoms. They are just normal symptoms of glaucoma. Reduction in your vision. Maybe you suddenly wake up in the morning, you see sudden reduction in vision. In most cases, it's a sign of glaucoma.
Reduction in vision, please explain that very well so people will understand that part.
Now, the reduction in vision, sometimes you might wake up, like you said, it's a gradual thief of sight. Glaucoma does not just come immediately. It's a gradual process. You might just wake up in the morning and, you're going about your normal activities, and you see that, I'm not seeing the way I'm supposed to see. Okay? It's not normal. It's abnormal. So when you feel or you see these signs, the best thing to do is to go to the eye clinic, to go to the hospital and see the optometrist or an ophthalmologist for them to get you screened, get your eyes checked to know if you have glaucoma or not.
Wow. Dr. Correa, please help me. I know that people are out there now. They were wondering, okay, at what age should people begin to go for regular glaucoma screening? At what age? Because sometimes people say, well, this sickness for this country, they don't even get AIDS safe. Because now you begin to hear that even children, young teenagers are even having hypertension issues and all that. So, is there age bracket for safety for you to start going for screening, and also what are the major risk factors to increase a person's chances of developing glaucoma?
Okay, so in the text, in the researches, what you will hear is that from age 40 and above, because the older we get, we are predisposed to developing some diseases such as this glaucoma that we are mentioning. So the books will tell you from 40, but in practice, we are beginning to see that there are a lot of early onset glaucoma. So we are now advocating that once you are 35 and above, regular eye check is necessary for glaucoma. Why? Because the early symptoms are not seen. The sufferer may not have the signs that I am having glaucoma, but something has started occurring. He talked about the wire in the house having a conduction problem. Most times we do not know that the wire is faulty until our light trips off.
True.
That is when we look for an electrician. But somewhere there has been a breach, a cut somewhere. Gradually there has been a stop of flow until eventually, sometimes there is fluctuation, and then we're like, what is happening? And then eventually the light trips off. That's how the symptoms are. At the early time, the sufferer probably would not know. Some things may appear a little bit whiter, sometimes a little bit duller, and the person was like, yesterday I didn't see this white as this, but today I'm feeling okay, because their signals can be off and on. But over time the symptoms get worsened. So because age predisposes people to these changes, as we grow older, the body grows older, everything that is tissues, our cells, organs are also growing older, so these effects begin to show up gradually. We are now advocating that earlier than 40, it used to be 40, but from 35 should have checkups every 2 years as an adult. But in recent times also, because of lifestyle changes, nature of food and body physiology, children are beginning to develop this glaucoma as well. So that is why in the last few years there has been advocacy for school health screening, even for glaucoma for school children. And then it has been shown that short-sightedness, which is myopia, People
Yeah.
that have short-sightedness are also at risk of developing glaucoma.
Please, why on this short-sighted matter? Please tell us. Short-sightedness, is it we are seeing visions that are like, okay, some persons like, so I've seen some persons when they want to read, they go like, and some are like, so explain. So what's going to be happening with that?
Okay, so short-sightedness,
Yeah.
there are different types. It's a type of refractive error.
Okay.
Now, short-sightedness in a layman term simply means that you see things that are very close to you.
Only clearer, better, right?
Yes,
Okay.
things close to you are clear, you are seeing them clearly, but things that are far off, the eye cannot see them clearly, and that is because that person's eyeball usually longer than the normal. There is a normal length that an eyeball should be, say about 24 millimeters, but this person's own is longer. We call it axial length. It's longer than usual. In the eye, there are structures called the retina where vision should be impinged on. Now, because the eyeball is longer than normal, the light rays don't fall on that retina. It falls in front of the retina, so the person doesn't see distant objects that are far clearly, but the things that are close, because it's closer to that person is able to see it. That's what short-sightedness means, or myopia, one will call it professionally.
Nice. Okay. I saw the way Dr. Akomodi was like, oh, okay. I saw the thing. Because, sometimes, some person will say, don't worry, I beg. Say, if you drink Gary, they will affect your eyes. Some kind of, there are some myths you have with this conversation. But I want to ask Dr. Motayo now, how is glaucoma usually diagnosed in the hospital eye clinic? That's one. But also another one is, once someone has been diagnosed with the glaucoma now, can the damage be reversed?
Concerning that, in the eye clinic, there are a lot of tests that has to be carried out before you can properly tell a patient you have glaucoma. But like my senior colleagues here have said before, the major factor for us that we consider is the increase in the pressure in the eye, the intraocular pressure. After that, we get that through a test called tonometry. So after doing that tonometry, if the pressure is high, the patient, we still have to go through tests like gonioscopy, OCT, and fundus imaging to be able to assert that this is what glaucoma, because it's possible the pressure of the eye is high and the patient might just be having ocular hypertension for a while and it's not glaucoma. And concerning changes that occur due to glaucoma, they are irreversible, because the optic nerve, once it sustains any damage, it does not heal. It does not heal because it comes from the same stem as the brain. So any damage to all those cells do not reverse, they stay that way. They can only be managed. Like anybody that has glaucoma now, once we diagnose that, it means that level of damage that they have is what we try to prevent and salvage the remaining vision that they have left.
Okay. Yes, you wanted to say something?
Yes, I would like to add that glaucoma is actually called a syndrome because it is not one specific thing. There has to be multiple occurrence before you can diagnose someone of being glaucomatous. Like he said, there are 3 basic things that are looked at before somebody is diagnosed as having glaucoma. The person must have an intraocular pressure that is higher than normal. Normal is between 11 to 17 millimeters with some instruments, and then 20 millimeters in mercury in some other equipment. When it's higher than 20 millimeter mercury, that person has an intraocular pressure that is higher than normal. And for the ordinary persons, it's likened to blood pressure. Everybody has a pressure in the body that is termed normal, 120/80, and when it increases, damages begin to occur. Say that person has high blood pressure. In the eye, when the pressure of the eye is above normal, it is called intraocular pressure that is high. Now that person can have high intraocular pressure but still not have glaucoma yet, because the other signs to indicate that this person has glaucoma are not there. The other thing to look out for is that there is a bundle called the optic nerve head in the eye. That is where all the nerves gather, and from the eye passes into the brain. Actually, the eye is termed the external part of the brain. So in fact, the eye is your brain, the part that humans can see. So the information, these impulses gather at that nerve, and then the nerve picks it and transports it into, the impulses are relayed into the brain. So when there is damage to this optic nerve head in the optic disc, you will see signs that indicate that this person is not having the normal head as she should be. There are damages to the structure, nasalization, tilting, and all those things. Those are for professionals. It shows that this person is beginning to have signs of glaucoma. The other thing is what is called field defects. The person begin to lose vision in some certain fields. They are supposed to see like a 360 degrees around. When the person begin to see some losses, maybe the person is looking at the sides, the person cannot see. Then if the person has field defects, an optic nerve head that is damaged, and an high intraocular pressure, that person is specifically diagnosed as having glaucoma. Now another thing is, all three symptoms may not be signs may not be present, but if there are two of these, either high intraocular pressure and field defect, or high intraocular pressure and optic nerve head damage, or optic nerve head damage and field defect without high pressure, then the person is diagnosed as having glaucoma. Because this last one is quite important, because some people will have a pressure that is normal, but damages are occurring in the eye. The nerve head is changing, the field defects are showing, the person is losing vision in some parts of the eye. Now for glaucoma patients, the last place to lose vision is the center, so they always see straight ahead, but the peripheral vision are damaged gradually and until at the last stages before the center of the eye, which is the macula, is also damaged.
Okay. Now with this, Dr. Komodo, what lifestyle habits do you think that people can use to prevent their eyesight and reduce the risk of having glaucoma? And also why at that, you can also add to the fact that is glaucoma hereditary, like some person say it's family?
Yes.
Really?
Yes, glaucoma is hereditary. It's hereditary. You know, it's one of the is one of the risk factors. Hereditary is one of the risk factors of glaucoma. Okay, and there is something I wanted to add in terms of the risk factors of glaucoma.
Please do.
You know, trauma. You know, there's some kind of eye injuries that can actually lead to glaucoma. Then also there's the part of the eye they call the cornea.
Yeah.
Okay.
Yeah.
The thickness of the cornea also determines is a risk factor to someone having glaucoma. Okay. And then drugs too. There's some kind of drugs that are risk factors to glaucoma, prolonged use of them, like the corticosteroid drugs that we use, for eye drugs that we use, prolonged use of them could also cause
you know what is important, because Nigerians, we have PhD in self-medication. No, that's the idea. Because anything is happening to you, kí ló ṣe báyìí, headache, láti bolo sibo, oh yeah, collect this one, balawo mi, ye pama, power system, kuba. Say, what's the matter? Nah, take this thing, take this. You know, understand? We have that PhD in self-medication. So some of these things is, so even when you take some of this, you're feeling itchy in the eye, just go to, like we say in quote, chemist or pharmacy, just go and ask them, give me, are you serious?
Yes. Then also there's some systemic diseases, that are predisposing factors of risk factors of glaucoma, like diabetes.
Hypertension.
Yes, hypertension. Migraine. Also, these are.
So that means if it's consistent, that means you have to check it.
You have to check.
You
have to check.
This one I have to ask Dr. Okori. I know that you guys are guys. Let me ask her, because I saw the way she looked at me like, are there meals you're supposed to be taking at least to just help you, because sometimes we're like, I beg, we've had issues like eat carrot for bright eyes, and so a person, the carrot just walk up as the carrot is finished. But what are they things that you could take at meals apart from lifestyle? So talk about rest a bit and everything. What other things are they going to be like? Are there special meals that you could take as against glaucoma? I don't know. Me, I'm just asking. No.
There are really no special meals to take, but any healthy meal that is like green leafy vegetables, red and orange fruits and vegetables are very healthy for the eye. Palm oil, it's very helpful to the eye. Omega-3 fatty acids are good for the eye. But the thing with glaucoma is when it onsets, meals and stuff are not the things that are going to cause a reduction in pressure or damages. So is regular clinic visits that is advocated for, so that you are seeing drugs are reviewed based on your pressure and the changes that are seen in the eye, so that from time to time, because once glaucoma happens, someone is diagnosed of glaucoma, it is going to be throughout life. It's not malaria that is treated, say, oh, you are cured, or tuberculosis, I say, if you follow a 6 months regimen, oh, this person has been tested and cleared of tuberculosis, is not there again. It's not like that. Glaucoma is managed, cannot be treated. It's managed throughout life to preserve the available vision that the person has. So we advocate that whatever good foods, healthy meals, fruits and vegetables that are okay should be taken, but that specifically is going to cure glaucoma, not available, please. Okay, so at this time we're going to open the phone lines so that the listeners can get to call, and some person might be having some questions for you. Yes, and we're having some questions. We're also streaming live right now on 97.5 Golden FM on Facebook. We're live on Facebook. Get to us, and you want to drop your comment or drop your question at all for. We have specialists that are here. Very, very special friends. Every Thursday we do everything has to do with medical, because we believe in your health. Your health is wealth. That is important. So call us up on the number 0707 747 1522 or 0912 Let me call it slowly so you can get the number quickly. 0707 747 1522 or 0912 0001975. You can send us a WhatsApp message on 0912 0001975, and of course we'll be reading it for you. If you have any comment, let's get to know. Let's get the first caller. Hello, good morning. The call is on hold. Okay, the call is on hold. I have yes, we have a message on WhatsApp already. It just dropped. It's a good morning, Golden FM, and the guests in the house. Please, my eyes are heavy. I can't look into bright light, phone screen, and even television screen. Okay. Said I can't look into bright light, phone screen, and even television screen affects me. Even I think bright atmosphere. So, what is the cause and remedy? Or Yaseye Israel is asking. The eyes are heavy. Phone lights and gadget lights are affecting them. Even the television screen. Screen. Now, eyes being heavy could be a sign of glaucoma, but it is not a definite sign for glaucoma. Okay. It could just be a general symptom for any other eye disease. But if phone gadgets, television screen are affecting you, that person likely has photophobia. Photophobia is that the eyes are not doing well with lights. It's as if they are shy of light. And heaviness in the eye could also be because that person probably has what is called computer vision syndrome. That means the person has spent so much time looking at the phone and gadgets. So the eyes are supposed to be lubricated constantly. It means that the eyes are dry. So that heaviness is a sign that the eyes are overworked. When you boil rice till the water is gone, you will feel the heat around your kitchen. Yeah. And by the time you perceive the scent of burn, you get to your kitchen, your eyes is burnt. So your eyes are giving you a warning sign. You probably are using your phone screens too long, so you have to reduce it. Now there is the 20-20-20 rule that says that look at your phone for 20 minutes, raise your head for 20 seconds, looking at a distance ahead of you 20 meters away is going to be of help to the eye. Take a lot of water if you are doing a lot of time with your phones, your TV, and your gadgets.
Let me just let you know, because while you're explaining, he just dropped a message. He said you are right for the long time watching phone screen. Hello, good morning.
Well, good morning, sir.
Good morning to you.
Yes, I'm having a problem in my eye right now.
Okay, sorry, your name, please. I need you to walk away from your radio. You are close to your radio. Walk away from it.
I am Children Gabriel.
Okay, Gabriel.
Yes, sir.
I'm still getting feedback. Just walk away from your radio. Walk away from radio so that everybody can hear you, and the guests too can also hear you.
Okay, sir.
I think you've done it.
So for 2 weeks now, I went for eye operation.
Okay.
So I talk to you now, the vision is not yet there, so I don't know what's really is the problem. And one of the side that I'm using, I'm not seeing it clearly again. When somebody is far, I can't recognize the person.
Okay. So was that the operation you went for?
Yeah?
Okay, you went for an eye operation, right?
Yes.
What was surgery? Okay. What was your diagnosis? What was the diagnosis that was given to you first before you went for the surgery?
The eye was just coming down to it was. I was just one of the side. I was just seeing through a narrow point, getting to closing point. So it was then I decided to go for operation.
Okay, don't worry. Okay, don't worry. I'll get to respond to that. Just hold on, Okay, we have another call. Hello, good morning.
Good morning.
Good morning to you.
Ogatama.
Ogatama, welcome.
I want to ask you that glaucoma gets. They do surgery for glaucoma.
Okay.
Now the question.
Okay.
Good morning.
Good morning. Please, Doc.
Okay, so the first caller, it is sounding like you had a cataract, and then a cataract surgery was done on the eye. When we go for surgeries, we actually expect our visions to superbly change at once. It's your recovery process might be different from the next person. Remember that when a surgery is done, the natural architecture of your eye is disturbed, so it will clear gradually depending on the kind of surgery that you've had. And then as you begin to take the drugs, because the surgical process can cause what is called an inflammatory process, so it looks as if your vision is dim. But as you begin to take those drugs over time, it takes from 6 weeks to 3 months to say that the surgery was successful or not successful, and 2 weeks is still early on. Just be a little bit patient, follow the drug regimens that you have been given and all the other post-surgical cautions that you were told to take, and then gradually you find out that the vision will improve as the artificial lens that was put settles in, because the artificial lens needs to settle in, your body needs to accept it, and then it begins to function well. For the second question, yes, there's surgery for glaucoma. I cannot drain it as fast as it should, and then there is closed angle glaucoma where the point to flow through is too small, so the fluid is gathered and causing damage to the eye. So depending on the type of surgery, if it's closed angle, the angle has to be open. But yeah, there are surgeries for glaucoma, and there are centers in this country, luckily, that does that surgery. Thank you.
Okay, so the phone line still remains 0707-747-1522. Let's get this call. Hello, good morning.
Good morning.
Good morning to you. Your name, where are you calling us from?
Yes. Please, I'm Dr. Morris.
Okay.
Not a medical doctor.
Okay.
I want to find out if pterygium of the eye can also be known as if pterygium is can lead to glaucoma.
It's a pterygium of the eye, right? Okay, Dr. Kobundu.
Thank you. Pterygium cannot lead to glaucoma.
Okay.
Okay. Pterygium this one takes place at the external part of the eyes. Okay, and it's just a little incision, scraping, to scrape it out. It can't lead to glaucoma.
Okay.
But it can affect vision when it gets to the part of the eye, the retina. It can affect.
Okay, we have another call. Hello, good morning. Your name, where you calling us from?
Good morning. Good morning.
Ogatama.
Tama, come back.
Okay.
Please, she said there's a center for operation where they do surgery for glaucoma. Please, I don't really know. I really want to know where they are doing it. Good morning.
Okay. He wants to know the standards because sometimes some person wondering where is it do I have a center around if it's not in Biosite in the Niger Delta or something like so we can get to know. That's what he's asking.
UPTH does surgery. That's a public facility, but there is Lily Clinic at Warri, and then Eye Foundation Lagos, Skipper IQ Lagos. Glaucoma surgery is all there.
Okay.
But Port Harcourt is the closest place.
Okay, we have another call. Hello, good morning.
Hello, good morning.
Good morning to you.
My name is Murphy. I'm calling from Osiri.
Welcome, Murphy. Please go ahead.
Yeah, I have a question to ask the doctors there.
Please go ahead.
I have an issue with my eyes. I can't see small characters. If the characters in the book is small, I can't. And my friend told me that it's not glaucoma or something. My issue is different from that. That's why I say let me please know.
Okay, you can't see small characters in the book, right?
Yes, I can't read small characters in the Bible, any book I'm reading.
Okay.
As long as the characters are
Okay,
small,
you only see large fonts, is it not so?
Yes.
Okay.
I don't have headache. I don't have pain in my eyes. So I say, let me call into you.
Thank you.
Okay, concerning this caller that just dropped the call, mostly it will be more than 40 years of age, and most times when we are more than 40 years of age, our lens in the eyes that helps us in that near vision to be able to see things that are close, like he said you could not read, the muscles in them become weaker. They call them the ciliary muscles. Okay. So when they are weak, they can't contract like they should contract. So you won't be able to see things that are tiny like that. So this is what we call breast myopia, most likely. But the patient should try to find an eye clinic and go for proper checkup.
Okay, let's take the last call before we go on. So we're going on break very soon. Hello, good morning.
Hello, good morning, Golden.
Good morning to you.
I still remain South reporting from Aeroport constituency.
Welcome, Sapere.
Greetings to our doctor. Thanks. Plenty thanks to them for the information. Well, I have a little problem.
Okay.
Yeah, I do a lot of straining of my eyes when I read, and after reading, I have some kind of eye ache. What would have been the... Thank you.
Okay. It does a lot of reading. Sometimes a person can really read, and then after that, eye ache or something. So what should it?
Okay, maybe he has been straining his eyes, a little more longer than he's supposed to, and also he, depending on what he's reading with, if it's a gadget that he's reading with, maybe prior exposure of his eyes to the rays from the gadget could actually cause the strain.
Okay, interesting. Oh my God, see, it's a whole lot because people when you talk about eye, people are like, okay, I beg, help us, let us know what's happening. I know the thing, so normally you're always going to see it. But also, I think we can to sneak in one more call before going to break. Before going to break. We're going to break very soon. Hello, good morning.
Hello, good morning.
Good morning to you.
I'm Dr. Murray. I'm calling back.
Okay, Dr. Murray, yes.
Yes, this pterygium is on one part of my eye, and each time I read, sometimes it becomes red. So what do I do to solve that problem?
Okay.
Thank you.
Thank you, Doc.
Okay.
Your pterygium probably is inflamed. And because we are all users of gadgets these days, these phones, the light that comes out of the phone emits what is called ultraviolet rays. These rays are harmful to the eye. Now the pterygium is fleshy. The composition is in a way that it traps these ultraviolet rays in it, and that causes inflammation and redness and pain. So you probably will need to see an eye care personnel to prescribe you an appropriate medication so that the inflammation can subside while you are as it were this thing to handle the problem from the screen that you are getting. And then you need to reduce your screen time. I just said some few minutes ago that the 2020 rule is very, very important, because the more time you spend, the more it, in a layman terms, your eyes are roasted. You need to stay away from your gadget a little bit to reduce the inflammation.
Okay.
Thank you.
Hello. Hello.
Good morning.
Good morning. Please, sharply. We want to go on a break. Quick, sharp.
Baby speaking.
Yeah, baby.
First of all, I want to thank the guest. And secondly, I want to say I am a glaucoma patient. When they talk of the surgery, I did my own surgery in India, even though it was not successful. I want to say this because not just that I'm a patient, I am also involved with persons with visual impediment here in Bayelsa and even Nigeria.
Baby, quickly, 30 seconds because we are going off now. 30 seconds, quickly. Or can you call back afterwards? Yes, we'll call back afterwards. Okay, no problem. Okay, mine. The lines are really buzzing, but we have to go on a break. We're going to break, and so you can take a breather. And of course, it's still Let's Talk Nigeria, and we are looking at, it's the World Glaucoma Day, and the week in itself, we want to have a conversation around it so that we're going to have healthy living, healthy eyesight, so we can see afar. After all, if you look as far as your eyes can see, God has given to you. Let's go on this break. We'll be right back after this.
This is your golden moment. 97.5 Golden FM, the gold standard of radio.
Which kind of life be this self? Why my own things can't do different? Chai, I don't suffer. What thing I could do now?
Neighbor, this one where they talk to yourself, they shed tears like this. What thing happen?
Neighbor, my body no dey answer me again as a man. No urge at all. Any attempt to shake body, 2 minutes I don't throw away like foul. Every time weakness, so network failure. I don't suffer.
Abba, all these things they happen to you and you just keep quiet. You never hear about Baba Champion for real men. That man where they use root and herbs, they finish matter for anything will be man palava. Now only men problem he they handle. Anyhow where he be, Baba Champion gets ubunge root, champion action for real men. He go correct everything when your manyama don't spoil for your body. Set your body well, make you stand get but take down quick, get back to real action.
Even as I don't pass 50 years.
Even if you don't reach 70 to 80 years, champion action they good well for you. The day when you start to take that champion action, now that day could begin work for you.
Baba Champion day for stand 9 Eastside NT compound, Azikuru Road, Ekeki in Agua Bayelsa State.
Give me the number, make I rush, go see her, Kia.
081-377-13684. 081-377-13684. Baba Champion, now for real men.
Want to grow your business fast? Golden 97.5 FM has got the perfect solution for you. You can locate our radio house at Mike Opopo Street, Bansha, Yenagua, Bayelsa States. Whether it's your business, music, event, or special promo, Golden FM has got you covered. So hurry now and let's put your brand in the spotlight.
This is 97.5 Golden FM.
That's right.
Don't go nowhere. We will be right back.
Okay, and yes, we're back. This is the final lap of course, Let's Talk Nigeria this morning, and it's in celebration of World Glaucoma Day. My goodness, I have not finished talking, and the lines already buzzing. Let's get the calls. My word, lines are buzzing. Let's get back to the calls. Hello, good morning.
Hello, good morning. I'm calling back. Murphy from Osiri.
Ah, okay.
Yes, there is a time someone told me to be taking onions in the morning and carrots. And I took that for, I think it was close to 2 months. And I noticed that my view, I start reading characters that are more smaller. But I couldn't continue. When I stopped, the thing now came back to normal again. So I want the doctor to say something about this too.
Lifestyle, no problem. Thank you. You could be saying that 0707 747 1522 or 0912000197. But Dr. Komo, don't worry. I know you talk on this one. There's a line that's been buzzing seriously. Hello. Hello, good morning. Okay. You get to call back. And if you send a WhatsApp message, you can send a WhatsApp message to 0912000195 and we will be reading it for you. Hello, good morning.
Hello.
Yeah,
good morning.
Good morning to you, sir. Your name and where you calling us from?
Mr. Little, calling from Mamata.
Mr. Little from Mamata, please go ahead.
Please, someone called, just like one of the callers said about not seeing small character.
Okay.
And the presenter there talk about a man from 40 years. What about the situation whereby a little girl that cannot see small character?
So what age is the little girl? For clarity's sake.
8 years to 9 years.
8 years to 9 years. Okay.
Yes.
I don't want to preempt the doctors, but I should be using more of the screen and the phones and everything.
I don't understand. So what?
Okay. Is she a regular user of the phones and phone and everything, like to play?
She reads, but when it comes to little character, tiny character, she can't really see.
Okay. So I'll end the call and I'll let them answer for you.
Okay.
Thank you, sir. So when you have issues of in kids, sometimes you see they can't see tiny characters.
Yeah, when a child or an individual can't see, emphasis on the child.
Yeah.
They need to bring the child to the clinic.
Okay.
There are a lot of things that could be, could cause the child not to be actually seeing those tiny characters.
Okay.
At that point in time, then when the child is screened, we'll know the right lenses and right lenses to recommend for the child to enable her or him see very well. Then for the other caller that said eating onion and carrots are actually good for the eyes. They contain carotene, which are very good for the eyes. And but I will say maybe what might have made him feel that he's actually seeing those things, or he ended up seeing them very well, might be psychology. They say health. When you say health, it's when you are psychologically, emotionally, and you're physically okay. That is when you're in good health. Maybe psychologically, he feels that taking this, as I was taking this, my vision improved. And how old is he now? If he's more than 35 years or 40 or above, I think the best thing to do is to visit the eye clinic. He has gotten to the stage of presbyopia.
Okay. Let's get this. Hello, good morning.
Good morning, Mr. Paul.
Yes, good morning to you, sir.
Yeah, this is Joshua from Yenza.
Joshua from Yenza. Please go ahead.
I just want to ask your guest over there. Like someone like me, I think since my primary school days, if they are writing something on the classboard, the board, I can't see.
Okay.
I have to leave from back to front before sometimes I leave my books to get copy of the handnote from my fellow colleagues. Up to today, even if somebody is very far away from me, I can't see the person until I move closer to that person. If I know somebody is calling me, I can't see that. I don't know why. So up to now.
Okay.
So please, I need the answer to that, please.
Okay, don't worry. They will answer you. Let's get this call. Hello. This happens to be the last call. Hello, good morning.
Good morning, sir.
Good morning to you, ma.
My case is
Your name first. Your name. Where calling us from?
Sir?
Your name. What's your name, ma?
Okay, my name is Elizabeth. I'm from Magura.
Okay, from Magbara. Okay, please go ahead, ma.
My eyes want to explain. Like, if person say, I need a picture, I dey see the person, but I need a picture capture the person's face because something like Amatan, something like Amara of smoke. To recognize the person's face, I'm seeing the person, but to recognize the person's face is difficult for me.
Shana, when the person they far, I mean when the person they close to you.
If person they close safe, to recognize the face,
you will be a matter.
they worry me. Yes.
No problem. And they go answer Nana. They go answer Nana. Thank you, Mama. Please.
Okay, so the person that says that since childhood, I think from professional perspective that you have myopia, which is short-sightedness. Now myopia grows as the child grows, it increases, and then it gets to a point where it stabilizes, and then you just need to come to clinic and be seen, and what you need is glasses. That's what's affordable in Nigeria right now. In the developed climes, you can have surgery so that the curvature of your cornea, the front part that is overcurved, can be reduced, and then you see normal like every other person. For here in Nigeria, you need to come to clinic, have an eye test, and use glasses or contact lenses. Madam, your voice sounds, the second caller, your voice sounds like you have reached your mid ages, above 45 or something, and you are complaining about not seeing well. You say you know they see well even if the person near you. The way when they look and so if as you call that word amatan, with one for clinic, most people when they tell us say that they see like say na amatan or dew, it be like say na cataract wey don start. Even this glaucoma when we dey talk so, it dey give that amatan this thing, but that one, that glaucoma go down high well. If not na the side then when you go complain say you know dey quick see well. But as you get this like this amata feelings, so e get wetin God put for inside the eye when person take dey see well, be like lens. That lens now e don dey thick. As we dey grow, e go dey thick. E suppose to clear like egg white, but e be like say e con dey thicker now, like when you don make starch small, whenever don finish na like that e con dey do now. So na im make you no dey see well. You go come clinic. When you come clinic, one will look am, we go tell you whether e dey the stage when e be say if you do some other thing go dey better for you to see. But when e don over mature, na operation wey dem go do, and if you no agree to do the operation, e come turn to morgangian cataract when they call am that big name. So glaucoma still dey corner again because of that one, because that cataract fit still go cause glaucoma. So your best bet now na to come clinic, make dem assess you, tell you wetin exactly dey do your eye. Telephone no go fit solve am like that. We need to see you to assess you well.
Mom Kwem, this is at this point maybe they say that drop mic moment. So at this point I want to say a very big thank you to all of our special doctors that are here. I'll start first with Dr. Koroye Egbe Ayakoro. Thank you so much, ma, for being here this morning.
Thank you for having me.
Thank you, Dr. Motayo Abayomi Victor Babami.
Thank you for having us here, sir. Thank you, sir.
Dokimi. And also to Dr. Akobundu Marachi. That's always our man any day, anytime. Thank you for coming this morning.
Thank you.
And thank you for also shedding light on the reasons why we need to take proper care of our eyes. And we wish you, from Golden FM, wish you a very fruitful day and also very fruitful campaign too ahead of you. Thank you. And that's what we'll draw a package for Let's Talk Nigeria this morning. That is, of course, the 12th day of March 2026. Until we come your way tomorrow, Friday's edition, of course, Friday. You know it's Friday. Thank God it's Friday. Anything can happen and it's going to be good, sweet. And for any other interesting conversation, at the top of the hour, we'll come up with the news update at 10. My name is Paul Oblomgbaseka, also comedy ambassador. Thank you and have an amazing rest of the day.